points of communication.
Good afternoon, dear professors and colleagues. We will today present branches of ACA, MCA, and BCA and the point of connections and circle of Willis. It will be basic anatomy lecture. We will first discuss anterior cerebral artery. For anterior cerebral artery, it passes anteriorly superior to the optic chiasm, and it has 4 segments: A1, A2, A3, A4, and it's called horizontal, vertical, and distal segments. Branches of anterior cerebral arteries are medial lenticular striate, recurrent artery euphibnar, anterior communicating artery, orbitofrontal and frontobular arteries, and calloso-marginal precallosal arteries. Here we can see at lateral projection from ICA injection, we can see the vertical segment by arrows here, vertical segment, and then we can see distal A3 segment and the cortical segment. The 2 important branches are the precallosal artery and pericallosal arteries. Both, and sometimes we have some aneurysm here at this bifurcation, so we need importantly to identify the anatomy of these arteries. At AB projection, we can see the anatomy, horizontal segment, vertical segment here, and the distal cortical segments. There is also important variations at the anterior cerebral artery, what we call infraoptic origin of the anterior cerebral artery or ophthalmic origin from the anterior cerebral artery, accessory middle cerebral artery originating from A1 segment, fenestration of the anterior cerebral artery, and there is variations from the anterior communicating artery also, medial callosal artery, and sometimes we call trifurcation of anterior cerebral artery and bihemispheric anterior cerebral artery and azygous anterior cerebral, which is one anterior cerebral artery. Here is an image for infraoptic anterior cerebral artery and the origin of anterior cerebral artery taking off early inferior to the optic chiasm. This is angiography image as showing the recurrent artery euphibnar. From the contralateral image, we are injecting from the left ICA, and we can see the recurrent artery euphibnar passing vertically at this image by the black arrow. Azygous anterior cerebral artery, there is both A1 segment are seen conjoined to forming single A2 segment. Medial callosal artery, we can see here a third artery or third central artery originating from the anterior communicating artery. Sometimes we call it angiography trifurcation of anterior cerebral. Variations of ecom artery are 4 variations: A, B, C, D. The A is single or duplicated ecom artery. B is single large branch arising from the anterior communicating artery. C, the ecom vessel is not present and the 2 anterior cerebral arteries join together directly, as we can see here at this diagram. And D is azygous anterior cerebral. As we discussed, both A1 segments are conjoined to make a vertical A2 segment. The importance of variations for anterior cerebral artery, as sometimes we have the most popular aneurysm, the anterior communicating artery aneurysm, so you need to know the variations of the ecom. So you have, sometimes we call precious ecom or precious A1 segment if you have a plastic A1 or you have single anterior cerebral artery, so you need to preserve your anatomy and only back your coils within the sac during coiling procedure. Middle cerebral artery, it has 4 segments also, what we call M1 segment, M2, M3, M4, horizontal, insular, opercular, and cortical. The most important segment is horizontal or M1 segment for mechanical thrombectomy, what we call major vessel occlusion, and it ends by bifurcation into 2 segments most of the times, and sometimes it trifurcates into 3 segments. Branches of middle cerebral artery are medial and lateral lenticular striate arteries supplying the basal ganglia and cortical branch supplying the brain hemisphere. Pattern of M1 division, most of the time it ends at superior anterior division supplying the frontal lobe and inferior posterior division supplying the temporal lobe and parietal branch according to the dominance. Here we can see at the diagram the MCA divisions. M1 segment ends by bifurcation, then M2 segment, what we call insular branch, at the angular point at what we call at angiography Sylvian point, there is M3 segment start and then 4 segment at cortical branches. At this diagram we can see the angular artery, what we call the Sylvian point. It's most of the time important to identify, so not to cross with during angiography. I'll cross it very cautiously to avoid perforation within cortical branch or contrast extravasation. At lateral projection, we can also identify the angular artery. Variations of middle cerebral artery are middle cerebral artery duplications. There is double MCA arteries or accessory MCA, as we said before, originating from A1 segment and early bifurcations. There is short M1 segment and early bifurcations. There is no stem of the M1 artery or fenestration of middle cerebral artery. And this is in angiography image showing the duplication of middle cerebral arteries. There is two middle cerebral arteries arising from left side. Here early bifurcation at the red and yellow arrows. Short stem of middle cerebral artery M1 segment, then early bifurcation. Fenestration of middle cerebral artery also seen. Posterior cerebral artery is the terminal branch of the basilar artery lying superiorly at angiography, just superior to the superior cerebellar artery. It also has four segments, what we call mesencephalic, ambient, and quadrigeminal and cortical segments. Branches of posterior cerebral artery are perforating arteries, choroidal branches, and cortical branch. At this diagram, we can see them numbered from 1 to 10. Posterior communicating artery, hippocampal, posteromedial, choroidal, and 3 temporal arteries, and posterolateral choroidal arteries, pineal, posterior occipital, and calcarine artery. The most important variation of BCA is fetal origin of posterior cerebral artery. We have a large ecom with aplastic B1 and sometimes also conjoined with aplastic A1 segment. Also, we have persistent carotid basilar anastomosis through the trigeminal artery and anterior choroidal artery annexation of temporal occipital supply. This is an angiography image showing AB projection for posterior cerebral artery and its segment up to the cortical branch or B4 segment. Also, there is another branch called artery of Bergeron, which is a rare anatomical variation called type 2B. There is a single artery originating from one side from posterior cerebral artery supplying both salami and both midbrain, and if it's occluded, it will cause bilateral thalamic infarction. So it is important to notice if there is bilateral thalamic infarction at some patients, we can suggest of posterior cerebral artery of Bergeron occlusion. The most important variation for posterior cerebral artery is the fetal BCA, which we call large becum and aplastic B1 segment and sometimes ACA A1 segment hypoplasia. The last of it is anterior and posterior circulation is always connected. The most important connection intracranial is a circle of Willis, which is a connection between both ACA segments through the anterior communicating artery with its different variations as we called. And also there is connection of the posterior circulation through the becum arteries originating from the ICA and seen connecting or terminating at the posterior cerebral artery. The variations of circle of Willis is many variations. The rule is there is no rule. There is multiple variations from starting from hypoplasia to absent to duplication to fenestration, and the most important one always is the fetal origin of BCA. And this is a diagram showing the circle of Willis. Thank you.
شكرا دكتور خالد. يعني عايزين كومنت بسيط كده منك للحضور. لو احنا عندنا انجو اي بي سهل قوي نفرق الام سي اي من الاي سي اي. الام سي اي بيبقى رايح لاترال، الاي سي اي بيبقى رايح ميديال. طب لو احنا بنبص على لاترال بروجيكشن ازاي نفرق الاي سي اي من الام سي اي؟ ممكن تجيب صوره كده لاترال؟ ممكن بس الشاشه بعد اذنكم.
كان في صورة لاترال واضحة، ثانية واحدة. أعتقد دي ممكن تبقى كويسة.
ممكن نعرض السلايدز؟
هي معروضة خلاص. تمام. قفلناها ليه؟
عايزين نعرض السلايدز بعد اذنكم.
هو بيقفل. ثانية واحدة.
طيب يعني بدون سلايدز بنفرقهم ازاي؟
احنا مثلا لو احنا في الرايت اي سي اي مثلا هنبص على البروجيكشن بتاعنا اللي رايح انتيريور ده.
لا يعني لو انا عندي صوره لاترال وعايز افرق انتيريور سيريبرال ميدل سيريبرال،
البرانشات بتاعتهم بالباترن بتاعه الميدل سيريبرال ارتري هيبقى عنده بايفوركيشن، بعدين مكمل بانسولار برانشز في مالتيبل سيجمنتس موجوده. الانتيريور سيريبرال ارتري هيكمل فوق لكورتيكال برانش مدي بريكال لوزال وبريكال لوزال. لو مش عارف اناتومي هبص عليه مين اللي اقرب فيه اناتوميكالي السكال ماشي قدام، مين اللي ماشي ميديال.
الموضوع ده على فكره يعني كان بيمثل لي مشكله، بس حد قال لي الانتيريور سيريبرال بيبقى لقدام والميدل سيريبرال بيبقى لورا. بس هي
حضرتك لو انا مش عارف حتى هبص على السكال همشي معاك.
بالظبط.
مظبوط.
شكرا دكتور خالد.
بالنسبه لمحاضره الدكتور خالد دي مهمه برضو جدا، بالذات الامبلمنتيشن بتاعها في الميكانيكال ثرومبكتومي. يعني الايدنتيفيكيشن للارتريز للسيجمنتس بتاعتهم زي ما هو ذكر، مثلا ام 1 وام 2 وام 3، تبقى عارف فين اللوكيشن، البايفوركيشن ترايفوركيشن كوادريفوركيشن بتاع الميدل سيريبرال ارتري. كل ده بيفرق معاك في الديسيجن في الانتيسيبيشن للبرانشات المقفوله اثناء الميكانيكال ثرومبكتومي. فاحنا بنشكرك دكتور خالد على المحاضره دي. شكرا.
شكرا يا خالد. احب